Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to share with you what you can do right before you fall asleep so that you can fall asleep faster and stay asleep after knee replacement surgery. Hey everyone, so when it comes to falling asleep and staying asleep after knee replacement surgery, this can be a real struggle and a real difficulty. You're dealing with pain, you're dealing with stiffness, tightness, swelling, and just general discomfort in and around your knee joint. But here are a couple strategies, a couple tips that you can incorporate that hopefully is going to improve the ability to fall asleep faster when you're ready to go to sleep and go to bed at night. So the main goal, and this is what I tell all my patients, is we have to calm everything down. We have to calm down that pain. We have to calm down that discomfort, the stiffness, the swelling, the tightness. Everything just needs to really calm down as much as possible, because what's keeping you up is that irritation, that discomfort. You're just, you're trying to fall asleep, but your attention and your mind is all focused on what's going on in your knee joint. So the more that we can reduce that sensations and those symptoms, the better it's going to be for you to fall asleep more effectively. So what can we do to calm everything down? Well, first we want to incorporate some modalities. So potentially using some heat, using some ice. Honestly, whichever one feels more comfortable for you is perfectly okay and appropriate to use. So we want to use this maybe 30 to 45 minutes before you're ready and planning to fall asleep. Some other things we can incorporate are just some very gentle exercises. So very gentle range of motion, bending and straightening of the knee, or some very gentle stretches. And the thing with these is we're not trying to crank on the knee, we're not trying to get extra range of motion or break up scar tissue or do anything significant with it at this point. All we're just trying to do is do a little bit of motion that's going to decrease some of that stiffness, maybe bring a little blood flow to the area and make you feel a little more comfortable. Also, what we can incorporate is some massage. So massaging the muscles and the soft tissue around the knee joint. So you can do this with your own hands, you can do this with a family member or your partner doing some gentle massage for you. You can use a foam roller, a massage stick, a lacrosse ball, whatever works for you. The key though is just, again, doing these gentle motions, hopefully decreasing some of that stiffness, decreasing some of that pain and discomfort, calming everything down. And then the last thing I want to talk about is your pain medicine. So especially in those first weeks after surgery, you probably have some prescription pain medicine. You want to time it so you're taking one of those doses relatively close to when you plan to fall asleep and go to bed. Again, same goal, calming down that pain, calming down that discomfort, and decreasing as much as possible so it's not an irritant and the thing that's keeping you up when you're trying to fall asleep. Now, of course, we're never going to get to, probably, at least early on in the recovery, we're never going to get to 100% feeling no pain, no discomfort, no symptoms, and just feeling great. You're still going to have some stuff going on. You're still going to have some achiness, some pain, some discomfort. But hopefully with these different techniques, you can narrow it down and bring it down to a tolerable level that at least it's going to let you fall asleep within a reasonable time period and stay asleep, hopefully, for a prolonged number of hours. Thank you very much for watching. If you thought this video was useful, I really appreciate your likes. Leave your comments and your questions below. Be sure to subscribe. I post videos about everything related to knee replacement, frequently asked questions, how to prepare, recovery, exercises, and everything else in between. Thank you for watching.